Welcome to Morning Infusion with Dr. V, where we are intentional about connecting you with other entrepreneurs that have overcome and want to provide value to the audience. It's Dr. V here, where our coaching program teaches nurses to work on their computers anywhere around the world, making money and owning their own time. So today we have Dr. JB. So Dr. JB is an emergency physician. So we all know I used to work in the emergency department. So I love ER doctors, okay, because they are super fun to hang out with. And so tell us, Dr. JB, tell us a little bit. So if you had to describe yourself, like if you had to give a live bio. So give us a little bit about you.
Live bio. All right. So I am Haitian. I'm a first generation immigrant to the US and grew up poor in Haiti, poor in the US. But my family valued education. And so really strived hard in school, did my best. And then, I wanted to go into medicine since I was a child. I thought I was going to do pediatrics. So I did my pediatric rotation. Then I said, no. So, and I made it into emergency medicine. You know, I'm almost like by happenstance, I guess, because of the Haiti earthquake. That was really the pivotal point in me when I was able to go down and respond to that earthquake and realize that, I wanted to be more versatile in my skill set to really be able to handle any emergency that presents. So I could be that doctor that like raises my hand when they say, "Is there a doctor in the house?"
I love it. I love it. Now, tell me a little bit about the pediatric incident that kind of turned you off, or was it
Well,
other incidences?
I think yes, there wasn't just one incident. But I kind of what I realized when I was going through that rotation was pediatrics, I mean, they can't make any decisions, right? Like they're dependent on their parents. And so I still have a soft spot in my heart, of course, for peds, but I realized that I can be more effective in taking care of the pediatric patients if I focus on their parents. If I focus on empowering mom and dad, then they could take better care of their kids. So, in emergency medicine, I still see peds, but that's not all I see, right? So I get my peds exposure, but I also get to work with the adults and get to empower them so they can take better care of themselves as well as their children.
It's interesting what you said about becoming an emergency physician, because when I first started, the reason why I wanted to go down to the emergency department was because I had a patient that had a high white count. The patient had leukemia. And when the patient, like I was running for my life trying to, make sure the patient had everything that they needed, right? And at the end of the day, I realized what I needed to run. I wanted to know what I needed to run for, what I didn't need to run for, right?
Mm.
Should I, because in the emergency department, you want to be calm,
Yeah.
right?
Mhm.
And that calmness is what creates that environment, number one, for learning, for innovation, for us to move the needle forward. And so I like the fact that when you went to Haiti, you learned that you wanted to come back and be that emergency department physician.
Mhm.
So, so tell us a little bit. So you're the CEO of Hope for Med,
Mhm.
okay? And
Yes.
so tell me a little bit about that and where did that start?
So, if you, so I'm an emergency medicine doctor, right? So we'll go ahead and use a case from the emergency department, fictional, right? But I'm going to go ahead and put the healthcare system and make it my patient, right? So when you walk into the ER, you walk into the room, a patient's room. The first thing you have to decide is the patient sick or not sick, right?
Right.
And when you say, okay, here's the healthcare system, patient, is the healthcare system sick or not sick? I think many of us would say sick, right? Many of us would say the healthcare system is dying. Many of us would say the healthcare system is hemorrhaging because it is. It's hemorrhaging people, right?
Right.
And so if you look at the healthcare system's vitals, vitals are abnormal, right? And so what do you do as an ER doc? Well, I intervene, right? I don't know what's going on, but I am going to, you know, do everything I can to resuscitate this patient. And so Hope for Med is essentially my intervention as an emergency room physician to contribute to helping to resuscitate our healthcare system. Many of us came into healthcare because we want to help people, right? That's what we always say. Like, I want to help people, and that's the same whether you are a physician, a nurse, a PA, a pharmacist. Those are the stories I hear from everyone. Um, and so even people who end up leaving the bedside, you know, sometimes it's really hard to leave the bedside, right? Because the reason why they got into healthcare in the first place was to be able to have that connection with the patient and feel like they're making a difference in somebody's life. It's hard to find a career anywhere where you walk into the room, you've not met this person at all, right? And they just open up. They just tell you everything, right? You learn everything about them. Even information you may not necessarily want to know, they'll tell you.
Y'all was exposure to those people. I love it.
So we go back to the whole resuscitation, right? So we talk about the healthcare system, yes, it's dying. But then we look at the people in the healthcare system, the people who went into the system so excited, right? I say bright-eyed, bushy-tailed. I'm gonna, be a healthcare professional and I'm gonna learn how to, intervene and, save somebody's lives or at least make their life better or at least, give them um, peace and comfort. And then you look at those people and you find that many of them are shells of who they used to be, right?
Mm,
And then you find, if you dig deeper, that there is a mental health crisis amongst healthcare professionals, and many are dying by suicide.
mm.
So, when you put all of those things together, that was the reason why I created Hope for Med. Hope for Med is different than other. It is a wellness company for healthcare professionals, but it's different than others that are out there for a variety of reasons. One is that we look at the healthcare system as a whole, and so Hope for Med is not made for just physicians, just nurses, just this person or that person. I narrowed it down by saying it's made for healthcare professionals with licenses. So if you have a license that you worked hard to obtain,
Mhm, mhm.
then you can be a part of Hope for Med membership. And I Hope for Med intention is to be that parallel arm to the healthcare system, that arm that provides support, right? Support for each other, to really get through our day-to-day experiences, a place where you can come and just release, right? Because life in healthcare is so stressful.
Mm.
um, and so where is that safe place for you to go to just release, to really show your humanity? Is that safe place your work environment? And many people would say, not really, right?
Right.
And so Hope for Men was created to be separate from your work environment. It's its own entity. It's not affiliated with anything um, work related. And our sole purpose is really you, the healthcare professional, the licensed healthcare professional, and optimizing you and your health and your wellness.
I love it. I love it. And and that's the thing. I tell people all the time when you're in the emergency department and you encounter these emergencies, and there's this whole thing about debriefing.
Mm.
Well, you can't debrief, right? You can't debrief because you are literally running. Like you run from one person to the next person. So you're in this code blue, right? And you're in that code blue forever how long? So it's a five healthcare professional, okay, to one patient.
Mhm.
Well, while you're in that room, then those other patients that are out there, they still need their care, right? And so when you come out, then you have to provide care for them. And so the debriefing part is really tough. So I love what you're doing with Hope for Med. So now tell me a little bit about where you like, why did you decide to go outside of the healthcare arena to just kind of branch out on your own to do that?
What do you mean by go outside the healthcare arena?
So yeah, so when I say go outside the healthcare arena, I mean like you instead of, like developing this program in your hospital, right? What is one of the reasons why you decided that it was outside of there? Because I can imagine the reasoning, which is the reason why I do what I do. But you go ahead, you tell me your reasoning.
So initially, as I was planning it, I was realizing, this I'm in Florida. I'm in Orlando, Florida right now. And I was like, this program that I'm creating is bigger than Orlando.
Right.
It's bigger than Florida. It's even bigger than the US. So, you
That
know,
part. That part.
right? Because we are a global family, right? And Hope for Med has a global lens on. So it's open to people from everywhere, licensed healthcare professionals from everywhere. And it starts in school. So it starts in medical school, nursing school, pharmacy school, PA school, PT school, like when you're in your health professional schooling, and it follows you throughout your whole entire life in healthcare and beyond. One of the things that Hope for Med does that I think the healthcare system doesn't do that great of a job at is really valuing experience, right? I've had many conversations with people where they say the older I get in healthcare, uh, they try to push me out. Right? That was literally
Mm.
what they said. But there's so much to that lived experience. Books, man, I've gone through that, right? Like I've man had so much schooling, and then thinking that I'm ready to take on my first patient, and I go in the patient's room. I'm like, what did these books teach me? You know?
It's a whole different ball game, ain't it?
Whole different ball game, right? And so lived experience, actually being at the bedside, touching the patient, having these experiences, the good experiences, the bad experiences, they're all learning opportunities, right? And these are all things you learn by doing. Healthcare is something that you do, right? And
Right.
so there's so much rich experiences and stories and institutional knowledge that you acquire when you're at a place for a long time. And so, so that's why when I say Hope for Med follows you throughout your whole entire your career, because it does, because you can be a member even after you retire. There's so much you can provide back to the healthcare community, in terms of mentorship and just sharing your knowledge and experience for as long as you want to engage with Hope for Med.
I love it. So now tell me what was the catalyst? Okay, the catalyst for where you just starting this because there were certain incidences that happened that kind of pushed me into entrepreneurship. So tell me the catalyst that lit the fire and it was like we've got to do something different.
Mm. So when I mentioned that healthcare professionals are dying, both literally and figuratively,
Hmm.
you would be hard pressed to find a healthcare professional who does not know of a colleague who has died by suicide. Either first degree separation or second, but you'd
Hmm.
be very hard pressed. Amongst physicians, every year 300 to 400 physicians die by suicide.
Wow.
That's a huge number, and it's a number that's not advertised, but it's a huge problem, right? And
Right.
these were pre-COVID numbers. These were not COVID numbers. So now we're in COVID, and we're seeing so many people dying all around us, right? And just feeling really helpless. And so the concern was that these numbers were going to go up. And so when I got my first degree separation of a physician who died by suicide,
Mm.
I realized that I can't wait till tomorrow to start something. I needed to do it today. And so that's why I launched the podcast. And so I have the Whole for My podcast where I feature stories of different healthcare professionals to give them a platform to really be able to share their stories and connect with others. Because the feeling of loneliness, like I'm the only person, like there's something inherently wrong with me because I feel the way that I do, right? um, really kind of um, contributes to those feelings of, isolation and worsens mental health crises and could lead to suicide. And so I wanted to bridge that gap. And the quickest way when I said I needed to do something today was, hey, let's launch a podcast. Let's connect with healthcare professionals. Let's share their stories. Let's break these silos. Let's really show our humanity. And that's what we do on the podcast. And so the podcast was the first thing that was launched. And on the 1 year anniversary of the podcast being launched, May 1st. So the podcast was launched May 1st of 2021.
Mm-hmm.
And the membership site was launched. The ribbon cutting ceremony for the membership site happened May 1st of 2022. So
I love it.
um,
I love it. I love it. Because a lot of people, this is what I think a lot of people negate to understand that it is small shifts, right? Small shifts. Did you think you were going to have a membership site when you first, was that the grand vision of it? You,
yeah. So the grand vision was to have a membership site, but so this was the catch was when I was going through medical school and whatnot, they said, don't you go on social media, right? If you do stuff, if you post on social media, you can, lose your job and all these things. So they really scared me about utilizing social media. Um, and so, but when I determined that, hey, this is what I want to do, because because they deterred me, I didn't have a presence. I have barely used any of that stuff. Like my LinkedIn account had like 9 people. I didn't even have a picture. My Facebook account, had like people from my childhood that maybe, I connected with throughout the years. But that was really it. I didn't do IG. I didn't do any of that stuff. But when I determined really that this is what I was going to do, and truth be told, honestly, like I had been thinking about what am I going to do? I want to create something. I want to make something. I want to have a business, right? And then I would like look around as I'm in my show, I'm like, oh, maybe I can make the urinal. Ha, it's already been made. Every idea that I was thinking of was already made, right?
like that, what is that wick thing? Girl, I wish that I had that idea, right? Anyway, go ahead.
So, but one day this idea just came upon me, if that makes sense, right? Like I feel like um I don't know, I feel like it was meant to be, if that makes sense. Like it wasn't something that like I was like, scratching my head and being like, "Oh, what else can I do?" It just came upon me in like a flood. It's like, this is what you should do, right? Like, and I was like, oh, and you should do, and then like, so I have this whole ecosystem, like 20 years down the line, already figured out, right? Um, and so I can't say it was just me. I don't know if your listeners believe in a higher being or whatnot, but I really feel like that there was something else that put this idea in me, um that knew my heart that I wanted to do something and I didn't know what that something was, and the something is Hope for Med. So and because of that it's grown exponentially, right? Because I was like, oh, I had like 9 people, and I was like, well, I'm going to activate all of my social media accounts, and if whatever they said in training is true, and I'm going to lose my job for going on, becoming more present on social media, so be it. Because I felt so passionate about the mission of Hope for Med, right? The mission to help save the healthcare professionals that are at the bedside, that are working hard day in and day out and being forced to work more, do more with less, work harder, work faster, right? I'm still a full-time physician. I'm still a full-time ER physician right now. So I know I'm feeling the squeeze every single day I go to work. Um, and I needed to create this community for us. And so, we launched it. But I started with the podcast because that was the quickest way to be able to start doing something as I built up my social media presence, as I created, a name and a brand for myself, right? Because these things don't happen overnight. Like you first have to, make that first step. And here we are today.
And I love the fact that um, which I never understood why physicians didn't have a large social media presence, and sometimes some nurses don't.
Mhm.
I remember there was a time that someone posted something on my feed, right, and I didn't know that they had posted it. And when I came back, like the guy from HR was coming down to talk to me, and I was like, I didn't post that. You can see that she posted that, right? And so I had to be very intentional about what is approved for my feed, and so I had to change my settings, per se. But the thing that I love is that you have understood that the definition of insanity is doing the same thing and expecting a different result. And we had 30 to 40 physicians die per year from
No,
you know
300 to 400, not
300. Oh my God, 300 to 400 per year died prior to the pandemic, obviously. And that doesn't include all the healthcare professionals, right? That are dying from that and that second degree. I love the fact that you said, okay, enough's enough, right? We're not going to keep doing this over and over and over again. And so your podcast, so tell us about your podcast.
So my podcast features stories of healthcare professionals, licensed healthcare professionals, and students. Um, and it really is just a place for you to come share your story. It's we kind of talk about what you want to talk about, but the focus is on wellness. And so, we talk about burnout. Have you ever experienced burnout? We talk about, the difference between burnout and moral injury, grieving, death, dying, suicide, mental health, like all these topics that we don't really talk about normally, right? We bring the humanity um, of the healthcare professional out because we are. I take issue with this whole hero um, um, label that they had given us because we're not heroes, right? We're not. We're humans.
That's
Because
right.
when they call us heroes, then we're supposed to be superhuman. We can't. Even if we try to be superhuman, we cannot be superhuman because we're not superhuman. We're not, right?
Right.
But we are humans with hearts that want to help, hearts that will make us go into that burning building. That's why we all didn't leave when COVID struck, right? We
Right. Right.
wanted to. Like people asked me when it was coming, like, oh, you're a mom, you have these small children. Are you gonna go to work? Are you gonna stay home? And I was like, I'm an ER physician. I was
Yeah.
trained for this. I'm not
Right.
staying. I'm going in, knowing that my life was on the line, could have been on the line, right? Like
Right.
knowing that we didn't know what we were expecting. No, we had no idea which patient had COVID versus not. All these things in the beginning. We still went into that room,
That's
right?
right. That's right.
And I think these stories are stories that we don't hear, right? We just hear stories about, negative things about healthcare professionals and whatnot. And then also when you're at the bedside, it's not about you, right? It's about the
Right.
patients. You don't talk about yourself ever, really. But this is a platform where you can talk about yourself and talk about your journey and connect with your colleagues. And this is open to everyone. So patients hear it, but everyone hears it. But the focused audience is on fellow healthcare professionals.
Sweet. So now, tell me, tell the audience what's the difference between burnout and more injury.
So, so if we take a step back, there people they weaponize these words
Uh
all the
huh.
time, right? And
Right.
I take issue with that, with the weaponization of words.
Right.
Um, And, moral injury, they say, "Oh, I'm not burnt out," because, if you say that I'm burnt out, then there's something inherently wrong with me. When you look at the definition of burnout, it has nothing to do with like you as the person that, there's something wrong with you, but it's due to, uncontrolled stress in your work environment,
That's
right?
right. That's right.
Like your work. It's not you. All right, it's your work. But people are like, oh, I'm burnt out, or like it's me, like there's something wrong with me, and that's not, no, and then they say better issue is moral injury. Moral injury is, when I am forced to do something that goes against my moral compass, right?
Mhm.
When I'm not able to give the kind of care I want for my patients because of external factors that I have no control over, right?
Right.
So those types of things where I want to give my patient this medicine and I can't because of a variety of different factors. And so I get morally injured. And that's why, I'm hurt or whatnot.
I love
And the way I did a podcast on this, when I was just talking about myself, and the way that I kind of I think they're both legit. I think
Right.
both, but I think, the way that I use it is like, moral injury are those little nicks that you get every day you're working at the bedside. You
That's
know,
right.
moral injury is when I see a patient come in and they have something that is suspicious for possible a mass,
Right.
that is suspicious for cancer, right?
Mhm.
But I can't diagnose them with cancer on a CAT scan. And I can't admit them for a cancer workup in the ER because I mean the hospital, because that's not what they do in the hospital. That's an outpatient workup.
Mhm.
So I tell them, Mr. So and so or Mrs. So and so, we found this on your liver, on your kidney, in your lungs, and it looks abnormal. And I'm concerned, I'm really concerned that it could potentially be cancerous. And you have to, follow up with your doctor. Do you have a primary care doctor? No. Do you have insurance?
Mhm.
No. Um, well, let me see what I can do to help. Let's see if we can, get the social worker in here and help get you connected because you need to have this so you can get this done, right?
Right.
And then I go and we discharge this patient
Mhm.
back out to the community. And X amount of weeks or months later, they come back. But this time it's not one mass,
It's
it's multiple,
right.
right? That is moral injury. That's my nick, right? I'm like,
Right.
oh, because I wanted to do more for this patient, but I couldn't because of these external factors, right? And the more nicks you get, that contributes to symptoms of burnout, right? So it's not the nicks themselves that cause burnout, right? You're dealing with all these stressors, right?
Mhm.
All these stressors and these nicks together that push you to say, you know what? Peace out.
That is one of the best. I thought about when nurses are in the emergency department just because that's just where I've worked at. But you're in ICU, right? And you have these patients, you have, 3 or 4 patients that are on ventilators because that's what happened at the beginning of the pandemic, right? You have all these patients that are on the pandemic and you're trying to save one, well, one is crashing and you don't have the ability to be able to go to that other patient because you just don't, you are a limited capacity. You don't have the ability to just do that, and that is those nicks. Yeah, they do cause moral injury, and that's probably one of the best explanations I have heard because that is a real true one that happens
Mhm.
every single day. And Dr. Susan Elliott, she said, this is such a great concept. Too often we take care of others and not caring for ourselves. Mental health needs to be very prevalent in the healthcare community. So we love what you are doing. So tell us how they can become a member of Hope for Med and how they can find your YouTube, how they can find everything.
Well, you can become a member of Hope for Med by going to our Hope for Med webpage, and it's hope the number 4 med. So HOPE4med.com. And once you go there, you will see a tab for membership. Again, it's for licensed healthcare professionals, so it's an exclusive membership experience. And what I didn't mention is, when I said we use technology creatively, we are in line with the future of technology. We think about like Web3, we think about the metaverse. So our activities are going to be taking place in the metaverse. You're going to be an avatar, and you're going to be able to engage with each other, with healthcare professionals from around the world, again, around the world,
I love
together
it.
on virtually. It's pure virtual, so you don't have to worry about gas prices. You don't have to worry about flights or anything like that. You just get in front of your computer or your laptop, you log in, and you engage in these activities together. So it's amazing. But hope the number 4med.com is where you'll be able to click the membership tab and apply for membership. And really applying for membership is, you just have to, because it's exclusive, right? You have to give us your ID, your license number, so we can verify that you are indeed a healthcare professional, licensed healthcare professional. And it doesn't have to be active. So if you stop, if you're no longer bedside and you transition to something else, but you were a nurse, once a nurse, always a nurse. Once a doctor, always a doctor. It doesn't matter what you transition out to do,
That's
or
right.
transition out and you're doing currently. You are welcome to be a part of Hope for Men. And on that website, you'll also be able to access all of our podcasts and all the information about Hope for Men.
I love it. I love it. So thank you, Dr. JB, because you are just rocking it out. Being featured on news channels, you're doing the doggone thing. I love it. I love it.
Thank you.
So we will be having a master class on how to become a nurse coaching consultant to work from anywhere around the world, making money and owning your own time. The date is July 5th. It's next Tuesday from 6 p.m. to 8 p.m. So if you're interested, anybody in the audience in attending the master class, it will be there for you. Thank you, Dr. JB, again. And you guys have a phenomenal rest of your day.